So hello friends, now we are going to start with the hematology lectures, okay, from DAMS notes. So it is the Xerox notes of DAMS. It will help you to remember many points. Okay, so let's start. So first, coming to the hematopoietic stem cell, so they are pluripotent, okay, and two group: common lymphoid progenitor and common myeloid progenitor. And for this, monoblast, megakaryoblast, then erythroblast and myeloblast get formed. And this monoblast lead to formation of monocyte. This megakaryoblast lead to formation of megakaryocyte that will develop into platelet, and this will into RBC and this into granulocyte. And in common lymphoid progenitor, B lymphoblast, T lymphoblasts and natural killer cells. Okay, clear? Now coming to the next point, it is maturation of granulocytes. So first stage is your myeloblast, then promyelocyte, then your myelocyte, then metamyelocyte, then your indented nucleus is present in metamyelocyte, that is written here, no important, then band form, okay, and then neutrophil, eosinophil and basophil get develops. Clear? So the stages are myeloblast, then promyelocyte, then your myelocyte, then metamyelocyte, then your band form. Clear? Now coming to the some next important points. These cells have two pools, circulating pool and marginal pool. Okay, in event of infection or any injury, marginal pool is mobilized, okay, and then count will increase in your circulating pool. Now next point, some points are very important, okay, that is your first is your appearance, okay. So coming to the first, neutrophil. So neutrophil is special points, very important. Myeloperoxidase positive, neutrophils is alkaline phosphatase positive and proteinase 3 positive. These are very important. Clear? And your monocyte are acid phosphatase positive and non-specific esterase positive. Okay, so neutrophil is myeloperoxidase positive, acid alkaline phosphatase. So remember this, neutrophil is alkaline phosphatase positive, whereas monocyte is your acid phosphatase positive. Okay, and neutrophil is also proteinase 3 positive, whereas monocyte acid phosphatase positive and your non-specific esterase positive. Clear? Now your eosinophil have major basic proteins and eosinophilic cationic factor. Okay, now coming to the hemato-oncology. Okay, so this was the basic about the hemato-oncology. Now coming to hemato-oncology basics. So first point, I will discuss differences between leukemia and lymphoma. Okay, so leukemia means tumor cells are in blood, and lymphoma means tumor lymphocytes forming a solid mass. So when solid mass is formed, then we will call it lymphoma, and when it is in blood, then we will call it in leukemia. Origin is bone marrow. Here origin anywhere in the body. Lymphoma can be originating from anywhere in the body, but leukemia will originate from bone marrow. Now leukemia cells can lead to solid proliferation, and then we can say that leukemia can lead to lymphoma, and vice versa can also occur, that lymphoma cells can travel via blood to marrow and infiltrate it, then lymphoma will lead to leukemia. Okay, so lymphoma can lead to leukemia, leukemia can lead to lymphoma. Now when leukemia occurs, then abnormal cell proliferate in bone marrow. Okay, so it will suppress normal cell proliferation. Okay, so if abnormal cell proliferating in the bone marrow, it will naturally suppress your normal cell proliferation, and if normal cell proliferation gets suppressed, then there will be decrease in functional blood cells, and there will be mobilization of hematopoietic stem cell to go outside the marrow and make more blood cell there. Okay, because of the less space. Because of the less space in the marrow, hematopoietic stem cells are going to outside of the marrow, okay, in the periphery, and there it will form blood cells. So it will be known as extramedullary hematopoiesis. Now decreased functional blood cells will cause anemia, called bleeding, cause recurrent infections, okay, and a condition known as pancytopenia. And because these hematopoietic stem cells often go to spleen, hepatic cells, so that will cause splenomegaly and hepatomegaly. So this is a basic idea, basic concept. Now coming to the myeloid neoplasm first. So here cells are first, myeloid neoplasm is divided into three groups. Okay, we will divide myeloid neoplasm into three groups. First is your acute myeloid leukemia, second is your chronic myeloid proliferative disorder, and third one is your myelodysplastic syndrome. So coming to the myeloid neoplasm first. So here cells are not allowed to mature or differentiate, okay, and it gets stuck at various early stages of maturation. Okay, cells are not allowed to mature or differentiate, and it gets stuck at various early stages of maturation or differentiation. Okay, and there will be increase in number